Welcome to Mountain Health Today. I'm Ted Owens, your host, a program sponsored by the Tahoe Forest Health System. We'll be back in just a moment. CFO Crystal Betts from the Tahoe Forest Health System, and we're talking about financial customer service programs in the system that are a benefit to the public. But let's get down to the more granular elements of that.
Sure.
I've received my bill, Crystal, for a procedure I had. 2 months later, I get a bill from the anesthesiologist. And I can go ahead and call your phone number, 582-3598, and what are you going to do?
Well, I'm going to go back a little bit. A lot of patients don't know they're going to get multiple bills when they have a procedure, and they don't necessarily know whether they're part of the health system or not.
And that's common. It's all across the country.
Absolutely. So we wanted to just kind of demystify that situation and allow the patient to call us no matter what. So if you called me and you had a question about your anesthesiologist bill, but we didn't send you that bill, doesn't matter. We're prepared to connect with the billing agency for the anesthesiologist, do that three-way conversation. We're going to try to do that real time, and we're going to work with you, that billing agency, to get your question resolved. So it doesn't matter whether it was a Tahoe Forest bill or not, we're still there to help resolve your issue.
And that could be even more complex. It could be things I might call you, I didn't read my paperwork correctly, and my insurance company's telling me that somebody who was part of my procedure is not in my network. And you'll help me with that too?
Yes. Sometimes we'll work with your insurance plan to see if we can get that as a one-time exception and get that covered. If they're not willing to move on that issue, then we'll look at, is there any kind of, this gets complex, but whether it's an HMO or PPO plan, we might be able to treat that as a self-pay with a discount. If not, then we have payment plans available or financial assistance or whatever you might need to be able to afford that piece that you didn't know about.
So it sounds to me like the team in the financial customer service program speaks a language that me as a member of the general public don't speak. So you know what questions to ask the insurance guy. I wouldn't know what to ask those.
We're your translator.
Yeah,
so
very much so.
You speak English and we speak healthcare. And so between the two of us, we're your translator to help resolve your issue.
Yeah, if I had questions about my insurance in advance of a procedure, you'll help me there too?
Absolutely.
And maybe advise me a little bit if you don't think my insurance is squared away properly. Can you aid and assist me in that?
We can inform you about your situation, but you ultimately need to make your own decision. So our goal is to provide you as much information as possible so you can make an educated decision about your own healthcare and the services you are seeking.
Now, eventually, you had mentioned like an electronic medical record system, and so this will be kind of tied into that program. How?
So,
what would I be able to do with that?
So our customer service representatives are also prepared to help you get set up on MyChart. And MyChart is a function of the electronic health system or record system that we have, Epic, that allows you to see your own information. And it allows you to have an electronic means to communicate. You can email. You can see your lab results, you can see your imaging results, you can see your bills, you can see the insurance we have on file. So we want more and more people to really play a part and get active on MyChart.
If I were a millennial and I didn't want to pick up the phone, would I be able to access the financial customer service program that way? Or is that something that might be in the future?
I think we're going to get more and more savvy about that in the future. We're not fully there yet to where the millennials don't have to have that personal conversation.
To be clear, I'm not a millennial.
Neither am I. Okay, so we're trying to figure out their needs and wants and make sure our program fits that.
And in terms of outreach, so that's an outreach item that you're studying. And how are you reaching the public? How do they learn about you?
So we've put out the information through a variety of ways, whether it's radio, newspaper, social media. We have brochures available in our clinics, but the future of where we want to go with this program is constant refinement, again, to learn from our community and our patients and make sure our program is fitting their needs and wants, and that we're also finding that our consumers or our patients are wanting to understand more about healthcare. So we want to provide educational sessions that meet the needs of our patients. So when they're asking us questions about their insurance plan because they don't understand it, that tells us maybe we should do some education sessions for the public on insurance plan, what's in-network, out-of-network, copay, deductibles, coinsurance. How does this all work? We want to get out there.
And this is really a buzzword that's used a lot today is consumerism. This is a big component of consumerism. This is how people want to interact. And do you think that there will come a time in the future where programs like the Financial Customer Service Program at Tahoe Forest will become more common?
I would hope so. I already know of organizations out there that have really started focusing on consumerism and knowing it's more than just patient care or patient satisfaction, that it reaches outside the walls of the hospital in a person's experience in the healthcare system. And so I fully expect this to become more and more the focus of many systems. It's already the focus of ours.
Well, I think the fact that Tahoe Forest Health System has constructed a financial customer service program probably speaks to the interaction of more rural base, because you do run into your patients, you do hear from them. It probably doesn't filter down in a large metropolitan area quite so much. Crystal, I want to thank you for being with us today. Crystal Betts, CFO, Tahoe Forest Health System. You're watching Mountain Health Today. We'll be back in just a moment. Welcome back to Mountain Health Today. We're here with Crystal Betts, Chief Financial Officer of the Tahoe Forest Health System, and we're talking about navigating the financial web of healthcare, and more specifically about the Financial Customer Service Program, Crystal, that you built, which has a dedicated phone number for people to aid and assist them in virtually every question they could possibly have. We talked a moment ago about the front end, the benefits of trying to get more information into people's hands in the beginning, but it becomes important to them on the back end. And this is where you can really have issues. You can do great customer care and great health care and high quality, but on the back end, it's been falling apart nationally. So on your financial customer service program that you built, tell us a little bit about how it functions on the back end.
Sure. So we have two pockets of our program that are available to help our patients. We have our financial customer service representatives that when you call our dedicated phone number, our 582-3598 phone number, you will 530, you will reach our financial customer service representatives. They're there to receive whatever question that you might have to ask, and their goal is to try to answer that in one phone call.
You said they're there. So when are they there?
So we decided that for customer service, you can't just be on business hours. So we made sure we had some extended hours. We're Monday through Friday from 8 a.m. to 6:30 p.m. We're also open on Saturdays from 8:30 a.m. to 5 o'clock p.m. So whether it's after 5 or on Saturday, we have a representative waiting to help you.
Are you busy on Saturdays?
It's slowly getting more and more busy.
Get the word out.
Yes, we just did our soft launch at the end of October. We're we're 4 months into the program. We've fielded almost 8,000 phone calls so far, and it's been very successful.
So I might call, let's say I've had a procedure and I've got some questions that have to do with my out-of-pocket expense, my insurance. You have folks that can help me with that?
Yes, we made sure that our customer service reps were skilled in everything from registrations, scheduling, authorizations, hospital billing, physician billing. We made sure that they had a solid understanding of health insurance plans, how they operate, why things get processed the way they do. So they were educated to be able to answer just about any question that
So if I
came
were to
in.
call, they understand, and I tell them my carrier is X, they're trained and ready to answer my questions.
Right. So if you haven't even had anything done at our health system and you want to know what your insurance would cover, based upon the information they'll ask you, they can look up your plan, see what your coverage is, see if we're in network or out of network for you, and we can start going down that path. So whether you've had services or haven't had services, they're still there to help.
I might stump you with this one. What do they do if they don't have the answer?
So there are times where it might be a very complex situation, and that's where we have our second pot of people ready to help, which is our financial counselors. And so they have a more greater in-depth information and understanding, especially dealing with things like our cancer patients who may be having services at places like UC Davis or somewhere else. So those more highly complex cases, we have additionally trained individuals that can assist.
And so let's say I have now spoken with your folks, and I now understand, might not be happy about it, but I understand why I have some out-of-pocket expenses. What if I can't cover those right now?
They are fully ready and prepared for that question, and we do have payment plan options, and our customer service reps should roll right into those options with you to find something that hopefully works for you. Because we do know healthcare is expensive, and we do know that a lot of people can't immediately pay their balance that's due, and so we want to have options available. And if it's just flat out not affordable, we have financial assistance programs that may be able to help.
So that's an awful lot of information, and I'm curious, can you really do this in one phone call? I know that's your goal. What are you hitting, 90%?
So that's one statistic that's difficult to track because we're doing the warm handoffs. So the financial customer service reps, if they can't, or actually the financial counselors, if they can't field it in one phone call, we do log it in our complaint system, and it's always triggered for a follow-up. So if we can't get your insurance company on the phone, or we can't make that connection with UC Davis, there's a tickler system that automatically re-engages us with the patient to make sure that follow-up happens.
And so that's well and good. Are you able to track your satisfaction rates?
So we want to make sure that our phone calls are going well, that we're solving our customers' issues, our patients' issues. And so there is a question at the end of the phone call that basically asks, how satisfied were you with your experience? On a scale of 1 to 9 is the scale, and I would say most of the time we get 9s. Our average is an 8. Anything below a 7, we actually go and listen to the phone call, because we do disclose that we record all phone calls, so we can go back and say, what could we have done better in that circumstance? We want to continually learn from these interactions to make our program better and better and better, and the only way we can do that is to listen to how the experience went down. Sometimes it's, somebody's just not happy because they owe money, and our rep was very cordial, was very helpful, did everything they possibly could, but the outcome was still the outcome, and that didn't make the person happy. So,
well, but you're taking a real good stab at it. We're going to talk a little bit more about the Tahoe Forest Health System Financial Customer Service Program that Crystal Betts built, our guest today, and we'll see you back in just a moment. Welcome back to Mountain Health Today. I'm Ted Owens, your host. Our guest today is Crystal Betts, Chief Financial Officer of the Tahoe Forest Health System, and we're discussing navigating the financial web of healthcare, a financial customer service program, a one phone number. What's the phone number just for the folks at home?
530-582-3598.
Thank you very much. Let's take it in a little bit of different direction. I think this is an incredible program. You're the only organization that I know of that has built this, Tahoe Forest Health System. What kind of outreach did you do as you approached the project in the beginning?
So the very first thing we wanted to do was educate our own health system. And so they needed to understand what this program was, what the phone number was, what information we had to provide to our patients so they knew how to contact us. We called it Bill Buster Fairs, where we invited staff to come learn about the billing or revenue cycle and how the financial customer service program was connected to that. We had a huge turnout, probably over I think it was almost 300 employees that came through our fairs to learn about this. We had individual flyers that we sent out as educational flyers to all departments so they understood what this program was about. Because they're our biggest advocates and connections to our patients. So if they're a nurse and a patient asks them, oh my gosh, I'm so worried about this financial piece, they automatically can say, we have this financial customer service program. Let me get you this brochure and reach out to them. They can help ease your mind on what's going on with the billing side.
That's a big investment to
Huge.
be able to take people offline and out of their daily work, and that's a big investment that was committed to.
Absolutely. We spent we did a variety of Bill Buster Fairs to make it available to all staff. So whether they were coming off the night shift or about to go on, lunch hours, we did everything we could to make it accessible.
That's impressive. And this is internal, though.
This is internal.
And so then you had another step, correct? You had that external outreach,
Yep.
which are the patients and the communities that the Tahoe Forest Health System serves.
So you should find brochures now in doctors' offices that are prominent, that are right there. And if you want to take one, please do. It has all the information about our program. We've worked with our marketing department to do outreach, whether it's through newspapers, social media. We're trying to get the word out to our community about this program, and that we're here for you to try to answer your questions.
And well received, I would imagine.
It has been.
And has it grown to the point where you have run into people that might share with your staff or Tahoe Forest Health System staff about how well it works?
We've gotten quite a bit of feedback, very, very positive.
And this is anecdotal feedback. I know that you do
Yes.
survey work, so you are able to find out from each patient.
Yeah, we have the survey that we have at the end of the phone call, but I've also received several emails about people just wanting to let us know about their experience and how wonderful it was. And so that feedback has been extremely important to us. It just helps us know we're on the right track. And this is just the beginning of the program. We plan to make it better and better and better.
I was going to ask you about that, because you've made an investment in the time of the health system's employees, the people that work there, investment in outreach into the public. You've made investment in training and staff so that when I call the phone number, I get a person that's all trained up and ready to address my issues, whatever they may be, or maybe even in advance, right,
Yes.
of a procedure. But people don't always stay in the same place forever, or you might have to increase it. So what does the future hold? You might have to do this training again if somebody were to leave.
So we've had a little bit of turnover. We've had one or two positions turn. Either customer service scores weren't as high, they were struggling on the phone or whatever it is. So we've made refinements to our program. We've created a training program. So if someone does happen to leave for whatever reason, we're well prepared to train the next individual to come in. A lot of the individuals we found have some great previous experience, so it's not as difficult to get them up to speed, but we still require them to go through every every single aspect of the training. They don't get to skip by anything. It just means they adopt better to the information than maybe somebody who hasn't been exposed to it.
And the information that you're gathering enables you to design continually
Yes.
for the future. To
Constant
improve.
refinement, constant refinement. Eventually, we want to get to the point where we can do more outreach to our community.
Do you know of anyone that's doing this in the health system world? Or is it only Tahoe Forest?
I don't. We didn't borrow this program from anyone. We took our own feedback we were hearing to create our own program. I'm sure other health systems are venturing in this area. Consumerism is a big topic right now, and the focus is really on the consumer, and that's even the healthcare consumer.
Well, I think that the Tahoe Forest Health System should be proud of constructing something that is truly unique. And what's that phone number again, so the folks at home know who to call?
It's 530-582-3598.
Okay, thank you. And also, really quickly, your hours of operation, again, Monday through Friday?
Monday through Friday, 8 to 6:30, Saturdays, 8:30 to 5.
So you can access the program when you get off of work or on Saturday mornings, if you like. Crystal, tell me a little bit about where you think things might go in the short term. You can adjust to healthcare changes nationally that are coming at you in continual education with your staff.
We believe so. We have great resources that we tap into. The associations we're connected with, from Healthcare Finance Management Association. We watch what Becker's is doing. We kind of see what current trends are coming our way.
I think you're
And,
leaving no stones unturned. I
try
think you're
not
doing a great
to.
job. Thank you very much for being with us. You're watching Mountain Health Today, sponsored by TFHS, Tahoe Forest Health System. Back in a moment.